Hi, I'm Manpreet, a lead tutor at the Aspiring Medics and a Birmingham Medical student, and today we're going to go through 10 key MMI stations surrounding current affairs. Station number 1. With the ongoing advancements in medical research, personalised medicine is becoming more prominent. What are the challenges and opportunities associated with implementing personalised medicine in the NHS? Personalised medicine essentially means tailoring a particular treatment towards a patient's individual characteristics, and these can be things in their genome, in their lifestyle, or their environment, all of which can be altered in order to improve their overall outcomes. Personalised medicine offers therapies that are more effective since they have fewer side effects, and this is essentially because they're tailored to that particular individual. This could be particular drugs that target very specific genes within the genome. However, personalised medicine also means that we have a more holistic approach when it comes to patient care, where we can address issues that stretch beyond just the mainstream drug therapies. We can look at more nuanced aspects of a patient's health, such as their psychological health, which could also be impacted when a particular disease progresses. So if we do also address these things, it means, again, we improve their overall well-being. Additionally, personalised medicine means that we reduce the time and resources that we spend on ineffective therapies, again, increasing efficiency when it comes to us delivering that care for that particular patient. However, personalised medicine does come with a lot of challenges, particularly the main one being cost. Personalised medicine involves a lot of expensive genetic testing and specialised treatments, which can place a significant burden on the NHS, where our financial budget is already being quite stretched. Also, a very large interdisciplinary team is required in order to produce these treatments. We need a whole team of scientists, doctors and researchers, all involved in these trials. Implementing personalised medicine within the NHS on the whole for each patient would require a significant change within its infrastructure, technology and training, which isn't very easy to accomplish at all. And finally, another challenge is ensuring equity in access to these treatments. It would be very difficult for patients from all different types of backgrounds to have equal access to this personalised care. Station number 2. Antibiotic resistance remains a significant concern in healthcare. How can medical professionals address the issue of antibiotic overuse and promote responsible antibiotic prescribing? Antibiotic resistance occurs when bacteria evolve and develop this ability to survive the exposure of antibiotics, rendering these antibiotics essentially useless. Though this is more common in countries where the healthcare system is less developed, inappropriate antibiotic prescription is still a cause of concern in the UK in lesser developed areas. To tackle this problem, a multifaceted approach is required, with education being the main and biggest one. Healthcare professionals need thorough training on the risks involved with overprescribing of antibiotics and should be encouraged to consider alternative treatments when it's appropriate to do so. When discussing education, it's a two-way relationship, so we also have to effectively communicate with the patient and also let them know about the dangers that come with using antibiotics inappropriately. Patients can often expect antibiotics for common illnesses like the cold or the flu in the colder months. However, antibiotics wouldn't work for these conditions since they're all viral. So again, educating patients on the importance of using antibiotics only when it's necessary, completing their full course, and being aware of these dangers that come with not using them as guided would be beneficial in tackling this issue. It's important to remember that this issue isn't a simple fix, and there are a lot of socioeconomic factors that drive this problem. Medical professionals and the NHS should prioritise campaigns to educate the public about these dangers as well. The National Health Service should also invest in robust surveillance systems and monitoring of these antibiotic prescriptions so that we can spot patterns and tackle this problem in areas of the country. The NHS should invest in robust surveillance and monitoring programs to monitor antibiotic prescribing patterns and resistant rates. Another important strategy that the NHS can implement is the antibiotic stewardship programs. These programs are designed to guide and monitor clinicians on the responsible use of these antibiotics and to make sure that we're only using these very powerful drugs when they're necessary. Finally, stronger regulation is needed to control the use of these antibiotics, not just in the clinical setting, but also in agriculture, which can also contribute to this problem. Station number 3. Mental health issues have become increasingly prevalent, particularly among young adults. How can medical schools and the NHS better prepare healthcare professionals to address mental health challenges and provide support to patients? Mental health essentially refers to a person's emotional, psychological, and social well-being, and there are many reasons why someone's mental health may deteriorate. Historically, the healthcare profession and the medical schools haven't always been the best when it comes to addressing these concerns in patients as well as their own. Over the recent years, mental health in the UK has definitely worsened. We're seeing a particular rise in conditions such as depression and anxiety in young adults in the UK. Again, causes for this deterioration range from a variety of socioeconomic reasons, as well as any life experiences affecting that individual. There are several steps that medical schools and the NHS can take to better equip our future doctors and our current healthcare staff in addressing these issues. The first one being medical schools can integrate more comprehensive mental health training into their curriculum. This can include more seminars, more simulations, and more workshops within the curriculum. Patients would benefit from interdisciplinary collaborations between multiple healthcare specialties in order to better take care of their health. This can include collaborations between psychiatric institutes, with primary care, as well as social care as well. In addition, medical schools and the NHS need to provide strong and stable support systems for staff and students to better take care of their own health by providing support groups, helplines, and wellbeing days. Finally, campaigns are very crucial in order to reduce the stigma that's associated with mental health. Both healthcare providers and patients need to understand that mental health is just as important as their physical health, and a lot of compassion, time, and empathy is needed to address these problems. Station number 4. The use of artificial intelligence and machine learning in medical diagnostics is gaining traction. What are the potential risks and benefits of incorporating AI into the diagnostic process, and how can we ensure patient safety and data privacy? Artificial intelligence essentially uses programs and algorithms to solve complex problems, do reasoning, and do a lot of learning similar to how humans do. In the context of medical diagnostics, artificial intelligence is already being used in specialties like radiology, where we're seeing AI spot abnormalities in chest x-rays, CT scans, a lot faster than clinicians. However, AI is still a very new type of technology, and the learning curve that comes with healthcare professionals getting to grips with it is still quite steep. As mentioned, one of the key benefits of AI is efficiency. AI can analyze, gather, and store data a lot faster than humans can. This leads to a potential quicker and a more accurate diagnosis. Additionally, AI can identify patterns within this data, which could be early signs of a disease that could be missed by human clinicians. Consequently, this means that we're able to pick up on that disease a lot faster and start treating a lot faster too. However, there are a lot of risks that come with AI as well. Since AI is trained on a large subset of data, if this data already has biases in it, it means that the treatment plans and the recommendations this AI comes up with might also be quite skewed. To prevent this from happening, it's essential that we use diverse and representative data when coming up with these algorithms and programs, ultimately minimizing bias and improving our overall accuracy. Additionally, privacy is also a really big concern, since AI handles a lot of sensitive data, which means that it's prone, or it could be prone to data breaches. It's vital that we ensure that AI is used as a supportive tool to clinicians rather than a replacement for human judgment. Station number 5. The implementation of electronic health records has revolutionized healthcare information management. Discuss the impact of EHRs on patient care, data security, and the potential challenges of interoperability. Electronic health records are essentially a digitized version of a patient's paper charts. It contains all the relevant information that can be accessed by the respective healthcare professionals at the relevant hospitals and the GP surgeries. In terms of patient care, electronic health records mean that a lot of different types of healthcare professionals, doctors, nurses, physiotherapists, can all access the same information efficiently and quickly. This means that our ultimate care is more coordinated, which leads to better patient outcomes. The records being online also improves the accuracy, since it means that we prevent errors involved with handwritten notes, with notes being lost, as well as ensuring that all information about the patient is up to date. Additionally, electronic health records are also a very green incentive, since it means that we reduce the amount of paper notes that we have to do. The electronic health records means that patients have access to their own information, which means that they're able to manage their care a lot better, particularly in the GP setting, since now patients on the NHS app can access all of their GP records. This promotes better self-management and involvement in their own care. However, electronic health records also present a very big security challenge, since this data is very sensitive, and if it were to be breached, it could be quite detrimental. Additionally, one of the major health challenges that electronic health records pose is the issue regarding interoperability, since we're using a lot of different systems that all store this data in different ways. Since there are differences in the way that this data is being formatted, the way it's being stored, and the technology that's being used, this data has the potential of being fragmented, which can lead to even more efficiencies. Additionally, with the current state of technology within the NHS, with computers not being available or them being very slow, these very advanced systems can actually fall behind and make tasks a lot slower to do. Achieving interoperability between these different systems all across the NHS would require a lot of financial resources in order to ensure effective communication. Station number 6. In the light of the rising global climate crisis, what steps can the healthcare industry take to reduce its environmental footprint and promote sustainability in medical practices? The healthcare industry is responsible for a substantial amount of greenhouse gases that we emit. It roughly equates to 5% of the total worldwide emission rate. And these things come from a variety of places, such as water usage, energy consumptions, and transport needed for healthcare delivery. First of all, integrating green initiatives into how we deliver healthcare is very important. For example, hospitals can use LED lighting instead of the regular lighting. Hospitals can reduce their carbon footprint by using things like LED lighting and transitioning to renewable sources of energy such as wind and solar power. Additionally, designing new facilities of healthcare with sustainability in mind is also very important. We can use things like following the green building standards in order to do this. These can have a very lasting impact on energy and water conservation, as well as improving the overall health of staff and patients at these new facilities. Responsible waste management is something that we can also consider. The healthcare sector generates a lot of different types of waste, all of which can be reduced. We can reduce things like single-use plastics, like aprons, gloves, improving waste segregation for recycling, as well as ensuring the safe disposal of hazardous substances. If we can do all these things, we can substantially reduce our environmental impact. A lot of waste in our hospitals that's infected, such as our dressings, our used needles, all need to be incinerated. However, things like non-hazardous gloves and aprons also end up in that same recycling bin. And since that also ends up being incinerated, it adds to our carbon footprint. So it's very important that we're able to properly recycle the respective waste in our respective bins. Education and awareness is just as important in order to sustain our efforts. Healthcare professionals and staff, as well as patients, need training on energy conservation, waste reduction, and sustainable practices. We can also educate patients on using healthcare services only when it's necessary. For example, calling 111 for non-urgent emergencies instead of going straight to A&E. This reduces our carbon footprint by decreasing transport needed for the healthcare delivery. By doing these things, the healthcare industry can significantly reduce its environmental impact and lead the global fight against climate change. Station number 7. Medical misinformation and vaccine hesitancy have become significant issues in recent years. How can healthcare professionals effectively communicate with patients to address misconceptions and encourage vaccinations? Medical misinformation and vaccine hesitancy has become quite a big issue over the past few years. We're seeing patients being misinformed about the risks and benefits of particular treatments, preventative measures, and all of these lead to them missing out on not having optimum health. This became more of an issue around the time of COVID-19, where we were seeing a small proportion of vaccinated individuals have their health deteriorate as a result of very rare side effects of the vaccination. When a particular patient does come in with misconceptions surrounding treatments or vaccinations, it's very important that we foster an open communication style and address their issues with a lot of empathy. This would involve actively listening to the patient and their concerns without any judgment, building trust, and then personalizing responses based off of that particular patient's beliefs. Essentially, you need to get down to the very bottom of why they have these beliefs and truly understand why they have particular concerns surrounding a treatment, why they're afraid, or why they're hesitant. To give patients accurate information, the healthcare practitioners involved would need to give evidence-based information in a way that's easy for the patient to understand, whether that means using analogies, visual aids, or using simple language. Healthcare professionals would need to address specific misconceptions by gently correcting false ideas the patient may have with accurate and credible sources. They will need to do this whilst also validating the patient's feelings, and they need to do this in a non-confrontational manner, since this can upset the patient. Station 8. The opioid crisis has affected many countries, including the UK. How can NHS equip healthcare professionals to manage opioid misuse while ensuring patients receive appropriate pain treatment? The opioid crisis essentially involves the misuse of opioid prescriptions, as well as an increase in opioid-related deaths. This includes the misuse of pain relief medications like morphine, as well as more illegal sources of opioids such as heroin. A multifaceted approach involving education, guidelines, and support systems is needed to tackle this issue. First of all, the NHS can provide very comprehensive training and education to healthcare practitioners regarding pain management. This would involve emphasizing both pharmacological and non-pharmacological interventions when it comes to managing pain. Opioids aren't the only form of pain relief that we can give. There are lots of forms, ranging from pharmaceutical drugs all the way to TENS units, which essentially sends electrical impulses to relieve pain. This training that we give healthcare professionals needs to include the latest evidence-based research surrounding opioid prescription and risk assessments for addiction, as well as alternative pain treatments. Healthcare professionals also need to be educated on how to recognize signs of opioid misuse and addiction a lot earlier, meaning that we can also intervene a lot earlier too. It's important when we consider and discuss opioid misuse that there are a very wide range of socioeconomic reasons that can lead to someone misusing them. And it's very important that we discuss all of these with the patient, as well as social and their financial situations too. So when we do screen these patients, we need to be wary that we are asking all the relevant questions, such as their history regarding their drug misuse, their social and their financial history, as well as any mental health conditions that they may have. That being said, we should also not stigmatize patients who do actually need morphine for their health by automatically assuming that they are addicts. So ultimately, we need a very balanced approach when it comes to managing and addressing patients who do need opioids by considering both the risks of these opioids, but also the benefits that would come by giving that patient that prescription. Station number 9. The UK is experiencing an aging population. Discuss strategies to improve quality care for the elderly whilst considering the financial implications on the NHS. The UK is indeed facing an aging population, where although our elderly are living for a lot longer, the time spent in disability-free years is a lot less. They suffer with a lot more comorbidities and are on a lot of medications. To tackle this problem, the NHS should prioritise preventative care and early interventions to manage these chronic conditions, which are a lot more common in the elderly. This helps us tackle the diseases more effectively by reducing the need for expensive hospitalizations. This can be achieved by enhancing our primary care, where we can implement more home-based medicine, where patients can receive their care in their homes. This essentially reduces the costs that would come with patients being treated in hospitals instead. Other preventative measures may also include regular health screenings, vaccinations during the cold months for things like the flu, as well as more lifestyle modifications in their home. Additionally, investing in training in geriatric care also means that we improve our outcomes for our elderly, since we're able to tackle their unique problems a lot more effectively. The NHS can also consider partnering up with private organisations and voluntary sectors to share the burden that comes with dealing with these problems that our elderly populations do have. It's also important that we don't overlook the very important roles that family have when it comes to looking after their elderly parents or elderly friends. So we also need to make sure that we provide the right sort of resources, whether those be financial or emotional support for these people as well. By focusing on preventative care and enhancing our primary care services, we can provide more quality care for our aging population whilst being mindful of financial sustainability. Overall, by focusing on preventative measures and enhancing primary care services, the NHS can provide a quality service to our aging population whilst also being mindful of financial sustainability. Station number 10. There have been reports of a rise in maternal mortality rates in regions of the UK. Discuss the contributing factors and potential strategies to improve maternal health outcomes. There are several factors that can lead to the rise in maternal mortality rates that we're seeing in the UK, and these range from disparities in access to healthcare, socioeconomic reasons, as well as underlying health conditions that these mothers may have. For example, women in these deprived areas or these particular ethnic minority backgrounds might often face barriers when it comes to receiving effective prenatal care, which will then contribute to worsened outcomes. Additionally, conditions like obesity, diabetes, hypertension, which are more prevalent in particular ethnic subgroups or particular populations, can also increase the risk of complications during pregnancy and childbirth, leading to this rise in maternal mortality. So for this reason, the NHS should ensure equitable access for these vulnerable populations to high quality prenatal care and postnatal care as well. Additionally, there needs to be increased maternal health education so these women can be empowered with knowledge about prenatal care, about risks, about benefits of particular treatments, so that during pregnancy and after pregnancy, they can seek timely medical treatment. Prenatal screening and monitoring is also essential. Frequent prenatal visits allow for a higher chance of us being able to pick up conditions such as gestational diabetes, preeclampsia, and hypertension. Continuous monitoring would also mean that we're able to identify any fetal abnormalities a lot quicker, resulting in a lot earlier intervention, which would prevent any more complications. Finally, maternal mental health should also be given a lot more importance, as this has a significant impact on pregnancy outcomes. So this means that we may want to offer a lot more mental health support, such as well-being groups, well-being talks and helplines to mothers as well.